our final speaker today. She is the founder and president of Prenatal Partners for Life. She will share her experience, knowledge, and expertise in working with healthcare providers involved in caring for children with conditions that put them at risk of being euthanized. Here to discuss infant euthanasia and hospice, please welcome Mary Kellett.
Thank you. I'm honored to follow such a group of wonderful speakers, so very happy to be here, and I'd like to thank Joe and HLA for inviting me to speak. I guess the best way to share my experience with infants who are at risk for being euthanized or not treated is to share my own story. This is our son Peter. He was our 11th child. He was born in 2005, and at a 19-week ultrasound, some markers were revealed, and the doctors wanted me to have an amnio. And we declined. We said, we don't care what Peter has, we're going to love him, and we don't want to risk hurting him. Well, the doctor said, if you have an amnio, you'll have more choices. And I knew he meant abortion, and so we said, we'd never abort our little baby. We're just going to love him no matter what he has and care for him. He's our son. Well, Peter was born at 33 weeks by an emergency C-section. When he was only 3 pounds 2 ounces, just a tiny little guy. They gave him great care the first 2 days of his life until a test result came back confirming that he did have a condition called trisomy 18. For those of you who don't know, trisomy 18 is similar to Down syndrome, which is trisomy 21, but oftentimes more severe. And I say oftentimes because there's a range to these conditions. So we were very blessed. Little Peter, his heart was stable and functional, according to the cardiologist. And we were told there were no survivors beyond 2 weeks with trisomy 18. And so when they found out that he did have it, it was recommended that we stop all treatment. And they said, we'll wrap him up and you can hold him as he dies and we'll keep him comfortable. Well, our daughter had gone on the internet and she found many survivors living with trisomy 18, some people in their 20s and 30s. And so I told her, print off those stories and bring them up to the hospital. So she did. And so when the doctor came in, who had told me that there were no survivors beyond 2 weeks, I handed him these living kids, and I said, why did you lie to me? And he said, well, Peter is going to live a life of terrible suffering and pain, and he'll be a horrible burden to your family. And, we have to think about resources. And I knew that meant, he thought Peter was not worth the money. He said, he'll never be able to contribute to society. And I just sat there and cried. I couldn't even respond. They wanted us to make that decision very quickly. And we said, well, we've got to talk to our priest and our family. And we wanted Peter treated like any other child would be treated. We felt that, it didn't matter to us, that he would be like our other kids, that he would have special needs. We loved him, and we were prepared to give him everything that he would need. It was a battle getting him treated in the beginning of his life. There was pressure not to do anything. One doctor who I'd never met before Peter was born, a woman doctor, she came into my hospital room and she said, I want to talk to you as a mother, not as a doctor. She said, I'm a mother, and as a mother, if you want to be a good mother, you need just to let Peter go. You can't do this to your other kids. And again, I just sat there and cried. Well, we brought Peter home. The environment at the hospital was so hostile. We we brought him home. He was only 3 pounds, 11 ounces, just a tiny little boy, but he thrived. He was never put down. He was loved to pieces. He did many things they said he would never do. I taught him to drink from a bottle, and he grew, and he was just a happy, happy, sweet, sweet little boy. That's Maria kissing Peter. She was only 18 months old when he was born, and she never, ever left his side. That was her best friend. And that's her other daughter, Christine. And it looks like she's, in a lot of pain there hugging him. I don't know. He was just a joy. Christine now wants to be a special ed teacher and help take care of kids. Well, it was when Peter was a year old. It was actually after church, and I was just praying, and I just asked the Lord a simple question, and it was, Lord, what do you want me to do with the experience of having Peter? And boy, did God answer. And it was, I just want you to help others. And I just didn't understand how I could do that. I said, you know what my laundry room looks like. And I was overwhelmed with just my own large family. But I heard a little voice say, just do it and I'll help you. And so I called the Archdiocese and talked to the Respect Life director, and she was very supportive and said, yes, you need to do this. This is really needed. And so we started this nonprofit called Prenatal Partners for Life. And what we do is we offer support, information, encouragement, either before or after birth. Sometimes families don't know until after their baby's born that there are some special needs, so either before or after. So we offer that support by connecting parents with other parents who have already gone through the same or a similar diagnosis for life-affirming support. And that's very important. There's not a lot of life-affirming support out there. We're a 501(c), and we've helped families in every state and 29 countries. Really what we do is we try to take away that fear and replace it with love. And we send out our little lamb and blanket, and we have a beautiful CD. And this was just a note from a mother. And she said, I came home last night very down about things, and your box was waiting for me. I can't even begin to tell you how much that lifted me and my husband to open the warm and caring note from you, the beautiful prayer cards, and the gifts for my baby. Because of the difficult nature of this pregnancy and the grim and dismal attitudes of the medical professionals who believe termination is the answer, we haven't gotten anything for him. And it brought me to tears to know that someone out there can think of him as an actual baby whose life has meaning and value and a purpose, not just a broken child, a poor prognosis and bad outcome. It was such a grace to receive, and I can't adequately express how much it meant to us. So we really try to help the family and the baby feel treasured, valued, and loved. And so many times, sadly, I hear from people, your words of positive encouragement are the only thing hopeful we've heard. And that's very, very sad. This is our philosophy here. Every human person, no matter how vulnerable or helpless, no matter how young or old, no matter how healthy, handicapped, or sick, no matter how useful or productive for society, is a being of estimable worth, created in the image and likeness of God. There is such pervasive prenatal testing. There used to be, tests recommended for moms over the age of 35, but now that recommendation has changed. So now every pregnant woman is offered prenatal testing and strongly encouraged to get prenatal testing. There's new tests coming all the time. The Maternity T21, that's a blood test to detect different trisomies, Down syndrome and trisomy 18 and 13. That's done in the first trimester along with an ultrasound. And so, most doctors presume women will abort, and they offer abortion and pressure moms many times to abort. And I think sometimes they believe that abortion is the best thing for a mom and a baby and the best use of resources. Here's just some of the terms our families have been told. One mom, she was so upset, she said, well, the doctor said this was a therapeutic abortion. Another very common term is early induction, humane abortion, saying goodbye early. One family was told this baby should have been miscarried. Just think of this as finishing a miscarriage. Early release from all the suffering, end it and start over, have a healthy baby. And of course, don't make the baby suffer. And what we were told over and over, that, the baby will be a horrible burden. I remember one nurse told me, if you insist on taking Peter home, you are never going to leave the house except to go to doctor's appointments and back. And, it's so funny because now I go all over and I get to speak. And I remember, my response to her at that time was, well, I don't care. I never leave the house anyway. He's my 11th child. That doesn't bother me. And then the heartbreaking, never contribute to society, and valuable resources wasted. And then another tactic is, parents are told the statistics and are made to feel dumb if they don't conform to the norm. And this just recently happened to a local mom we helped here. And this is what she said. She said, I was given a 1 in 5 chance that my baby had Down syndrome, and then pressured to schedule termination. When I refused, I was asked repeatedly if I realized that 92% of women with my same test results would terminate. They tried to make me feel stupid for going against the norm. There was one appointment when 3 different people came into my room to recommend termination and confirmed that I understood how high my risk was for my child having chromosome issues. I literally changed doctors after that appointment to an OB who would support my decision to keep and love my baby regardless of how many chromosomes it would have. My son was in fact born with Down syndrome and heart defects and is as sweet and precious as could be. We adore him. The abortion rate is extremely high for kids with Down syndrome, spina bifida, cystic fibrosis. This is a picture of my friend Gretchen, who adopted these 2 beautiful little boys with Down syndrome. Many people don't know there's a waiting list for families who want to adopt kids with Down syndrome. The reason Gretchen and her family adopted these babies was that her husband grew up with a brother who had Down syndrome, and it was such a positive experience. He wanted that for his own family. There's just a lot of very negative and very heavy pressure. These are some of the things our moms have said. Looking back, I can see what was missing from the conversation in the doctor's office. They never mentioned anything remotely positive. Surely there was something they could have told us that wasn't bleak or morbid, like the fact that we could love our daughter no matter what her physical, mental condition. The abortion will always be my darkest hour. I understand the medical community looks at these children as lost causes. It is easy to see things in black and white in the world of medicine, but I valued that child and I was not heard. I was ganged up on, relentlessly pressured, and I was an emotional, hormonal, and physical wreck. And with literally only days to make a choice, it was a nightmare. So depending on the state where people live and the abortion laws, and when they find out there may be a problem with their baby, there can be time constraints. One family, they found out their little girl had most likely a chromosomal issue and some heart defects, and the doctor said, we can take care of this right here, right now. If you just walk down the hallway to another room, this will be over in a few hours. Just like that, wanting her to abort her baby. There's a new fairly new concept that's becoming more common called perinatal hospice. And it is supposed to promote patient-centered choice and humanity-honoring care. It has blossomed into a national and international movement for compassionate care for families. And how it's supposed to work is a kind and clear explanation of the diagnosis, and lack of ability to physically heal the child is given to the patient and the family. Perinatal hospice can be a great gift to families whose babies truly can't be helped and are dying. And the treasure of time is, a huge gift. Our baby has made such a wonderful impact on so many people and has been a true blessing. I cherished every second I was pregnant and every second I spent with him until he passed into eternity. And then another mom said, my biggest piece of advice to a new mother facing something like this is to not let the fear of the diagnosis scare you from seeing through to your child. A diagnosis isn't what a child is, it's just something he has. And so, we have many moms who come to us, many families, and, they're told their baby will not live, and the doctors are recommending, that they end their pregnancy, that they, kill their baby. And so perinatal hospice is a way for that family, to cherish that time. And for a child, who truly has a fatal condition, it's a wonderful, wonderful thing. And I always tell parents, you'll never regret embracing the life of your baby. I've never had a mom say she's had too much time with her child. This is one little baby we recently helped, and she was born with a condition called anencephaly, and she lived 79 minutes. The doctor, who was the head OB/GYN doctor of a large group, had never seen a patient who chose to carry a baby with anencephaly to term. So when I was with this mom at her doctor's appointment going over the birth plan, the doctor said, well, this is all new to me because, these moms all terminate these pregnancies. So this is the first time she had ever had a baby that actually was born with it. Just like the hospice at the end of life, there are dangers with perinatal hospice too. After we found out Peter had trisomy 18, one of the first people in our room were the perinatal hospice people, recommending that we, put Peter in hospice. Well, we had a friend, a neighbor who's a doctor, and he said, well, I told him we're supposed to put him in this hospice program now. And he said, well, don't you want Peter to live? Don't you want to treat him? And, his heart is stable. And we said, well, yeah. And he said, well, it might be, real difficult to get that kind of treatment for him if you put him in that program. So we declined, and I'm so glad we did. The other little baby is little Bella Santorum. She's probably the most famous little baby with trisomy 18. Senator Santorum came out here a couple years ago and spoke at one of our banquets, and he told the story of his little daughter Bella, and he said that Bella was put in hospice right away, and they were sent home with a prescription for morphine for her. And when they got home, their regular pediatrician came to see her, and he said, well, you didn't give her this, did you? And they said, no. And he said, well, because this is 3 times what you would give a baby, for comfort. So, my fear with perinatal hospice is that, kids are going to be put in the program that could be helped. And it's more cost effective to help these kids die than to help them live. And my fear is that it becomes kind of a dumping ground for kids diagnosed with disabilities. And, like our former speakers here today have said, every person is an individual, and you can't just use a cookie-cutter approach to perinatal hospice either. So I have friends who are running great programs, and, kids who will graduate out of it. I also know of families who try to get basic things like an antibiotic when their child, developed an infection. And, no, baby's in hospice. You can't have an antibiotic. And so the child ended up dying from, an infection instead of, the condition. So there's the same type of dangers I see a lot of passive euthanasia, you know, maybe not helping kids who need things like maybe just oxygen, maybe antibiotics. One of our families was told when their daughter developed an infection and she was in the hospital, the doctor said, you know, you don't have to treat her, and you know, you don't have to blame yourself. You can blame me. She'll go very peacefully. We'll make sure she's comforted. And the mom said, well, it's an antibiotic, right? Well, you know, she's got to die from something sometime. Families are often not given, you know, accurate, complete information on what they can do to help their child. One doctor said to us after we requested a test for Peter, well, what if we found something wrong? What would we do anyway? And I'm just like, well, we'd try to help him, you know. But it's often a fight for treatment. This is my little friend Lane, who's 3 years old. He's living with trisomy 13. He was born with heart defects, and his parents requested surgery for their son. When Lane was 6 months old, surgery was denied because of the pain and suffering involved, and the doctors felt surgery would not alter his overall prognosis. At age 1, a second opinion was given that nothing should be done because of his genetic condition. So his parents have now switched doctors and have found a new doctor willing to look at Lane as a child and help him, and not a diagnosis. I see a very utilitarian view of life out there. This is a quote one doctor said. We were helping a family with a little baby who had trisomy 18, and she needed a little procedure called a diaphragmatic plication. One part of her diaphragm was up, and it needed to be pulled down and put in place. And it was an easy procedure. And I was in the care conference with the family as an advocate for them. And the doctor said we could fix her diaphragm, and we could even fix her heart, but why should we? Because we can't fix her brain. I think sometimes when, kids can't be cured, like my Peter, he was always going to have trisomy 18, they look at it like, well, why treat them? Oftentimes there's a twisted, false sense of compassion that these kids would be better off dead and not living with this disability. There's a very eugenic mentality, and I think a lot of it is, based on money. These are two of my little friends who had surgery and are doing very, very well. They both have trisomy 18. Sarah is 6.5 and Caden is 11. Sarah had open heart surgery when she was a newborn and is doing very, very well. And Caden has had several surgery, and he's just doing great. He rides horses and goes on the Ferris wheel and has a very good quality of life. Euthanasia, the act of intentionally ending the life of a person. Alex mentioned the Groningen protocol. I was actually at the American Bioethics Conference this year. It took place in Minneapolis, and listened to a talk by the doctor. He's a doctor and a lawyer from the Netherlands who wrote that protocol, and listened to him explain how his country's infant euthanasia program works. An American doctor in the audience raised his hand and said, well, what cocktail do you use? And will that be available for us to know? And he assured him that yes, what they use, their cocktail to inject their babies, will be published and available information. He talked about their program with the ease of somebody talking about what they wanted for dinner. Nothing wrong fazed him, and I sat there just horrified listening to it. They became very good at diagnosing many conditions before birth, so the large majority of babies are aborted in the Netherlands, so they don't have to use their infant euthanasia program too much because they're killed before birth. So we were told Peter would lead a life of pain and suffering. This is him. He would always smile in his sleep. He was a very happy, sweet little boy, and I always say this, my other kids don't like it, but he was the easiest of all the 11 kids. From the time he was born, all we ever heard is, he's going to die, be prepared, he's going to die. Every doctor appointment, taking him in, he's going to die. And finally, when he was a couple months old, I said to his doctor, I said, well, doctor, when are you going to die? And he just looked at me, and he said, what? I said, well, you're fond of telling me you think, when Peter's going to die. I just thought maybe you knew when you were going to die, too, Well, he quit saying that. Yeah, I told him we are going to focus on Peter living and the gift of every day. This is a picture of me and my husband. Peter passed away last August, and we have many questions about what happened to Peter. He went into the hospital, and it was determined he needed his appendix removed, so he had surgery, and he died the next day. We felt from the moment all day that, something wasn't right, and we kept on asking questions. And anyway, after his death, the hospital called the next day and asked us if we wanted an autopsy, and we declined. And so the funeral home came to pick up his little body, and we went to the funeral home to plan his funeral. And the doctor, the funeral home lady, she said, well, how did your son die? And I said, well, he died after having his appendix out. And she said, wow, you don't hear that very often. And we said, yeah, we, were just really disturbed by it all. And she said, well, did you have an autopsy done? And we said, well, no, we just don't trust them. There's been too many other times that things have happened. And so we said no. And she said, well, you can have an independent autopsy done. And so we said, okay. So we had an independent autopsy done. And the doctor called us after she was done, and she said, I'm shocked by what I found. She said, your son bled to death. Yeah. So throughout the course of the day, we had seen his stomach getting bigger and bigger. And we asked, could he be bleeding? What's going on? The doctor ordered an ultrasound and did it himself and told us that he saw air. And so when we ordered Peter's medical records, we looked for the film of that ultrasound, and lo and behold, there's no film. There's just his record saying that there was air in his abdomen. Well, the autopsy doctor found almost a liter of blood in his abdomen. So we're, going to pursue legal action, and we're not looking for any money or anything. There's not a big payoff for how things work for Peter's little life, but there's, there's a matter of justice and the matter of, we fully expected him to come home, and, we wonder if he would have gotten the proper care, if that's, exactly what would have happened. We have a daughter who's a nurse, and when she found out how Peter died, she just cried. She said, oh, Mom, she said, that's one of the things you look for after surgery, is bleeding, post-operative bleeding, and, you take care of it right away. So we are wondering, was caring for Peter considered futile, and was allowing him to die considered compassionate and cost-effective? I testified in the Minnesota House and Senate on a law that would require hospitals to disclose their futility policies. We found out that the hospital Peter was at had an internal hospital futility of care policy, that we didn't know about, and we don't even know what it says. So Senator Nino wrote a law that would require hospitals to disclose their futility of care policies. So this year it was attached to another bill, but then it was removed by a voice vote, so it didn't go through. It's going to be introduced again next year, and there's also a bill written at the federal level by Congresswoman Bachmann for hospitals to disclose if they have a futility of care policy, and then if they do, what that policy is, and to make that known to patients. So hopefully that will happen. I think if we would have known, if the hospital had this futility of care policy, I mean, we were always very wary just because of the comments and my experience with other families. We never ever left him alone. Maybe Peter's death could have been avoided by a discussion, beforehand. I don't know, maybe not. But maybe we wouldn't even have taken him to that hospital. Maybe we would have taken him to a different hospital. So I think people have the right to know these policies exist, and they have the right to know exactly what they are before they, go to that hospital. We were never under the illusion that Peter would live a long, long life, but he shouldn't have died like he did. And our children shouldn't have, found out about their brother's death like they did. They followed my husband up to the hospital, and we're in the waiting room, and we had to go out and tell them that Peter had died, and it was horrible. They all started screaming, and one daughter collapsed. One of our sons threw up. He didn't need to die like that. That wasn't a very compassionate way to treat him. I call these kids teachers of our souls. Peter taught us so much. He never spoke a word. Couldn't talk, but he could smile and he could communicate. When I would feed him, sometimes if he didn't like it, he would just push that spoon right out of my hand and shake his little head no. He knew us, he loved us. His eyes would light up when his brothers would come into the room. He made us all better, he truly did. He was never a burden. The hardest part by far was dealing with the people who couldn't see his value. That was the hardest part. So I just try to help others, and we're going to try to find out exactly why Peter bled to death, not just for our own family, but for other families, and bring an awareness to this. So I would appreciate your prayers. And does anybody have any questions? Yes. Mm-hmm. Oh, yes, please do. Yeah. The question was if a mom has a child that's diagnosed with a condition and the baby's not going to live anyway, can she contact our organization? Yep, yeah, I have a table out there with brochures, and that's exactly what we do. We try to help people just let God be the author of their child's life and embrace the life of that little baby, and by connecting them with others who have gone through it for that life-affirming support. Yep. Well, thank you very much. God bless.